This is Dr. John Wycoff. Welcome to Pathway to Wellness. This is another podcast where we try to help educate you and empower you to get on that pathway to getting healthy and being well and emphasizing natural solutions. So much of modern medicine now is wrapped up with medication or referrals. You go to your primary care doctor, and typically they just do one of two things: prescribe a medication or refer you to another doctor who does the same thing, prescribes a medication, does a test, or refers you to another doctor. Seldom is much credence given to things like diet, supplementation, lifestyle changes. That's what I'm about. That's what Wycoff Wellness is about. And if we can be of service to you, we have a beautiful office in East Lansing, 1226 Michigan Avenue in East Lansing. You can stop by and learn more about us. You can find out more about us at wycoffwellness.com or call us at 517-333-7270, 333-7270. Today's program is about hypothyroidism, and we're going to call it Maybe It Is Your Thyroid, because that's a common question people have when they come in to see me. They're having symptoms of what they think is hypothyroidism. They may have read about thyroid disease. They may have talked to a friend. They may have been told in the past that they were borderline low on their thyroid, but their doctor didn't really pursue it, didn't maybe do the right testing, didn't want to address it. So we're going to talk about hypothyroidism, the symptoms. We're going to talk about hypothyroidism, the testing. And then we're going to talk about hypothyroidism, the treatment. So let's talk about hypothyroidism, the symptoms. Your thyroid gland is a walnut-shaped gland. It sits right here in your neck, kind of right above your collarbone. If you kind of feel, you actually feel the thyroid gland. It has two lobes, a right and a left lobe, and a little centerpiece called the isthmus. And it produces thyroid hormone. There are actually 4 thyroid hormones, T1, 2, 3, and 4, but the two that we know that are the most important and are the majority of the thyroid hormone produced are T3 and T4. T1 and T2 are intermediates that are produced on the way to production of T3 and T4. T4 is about 80% of the thyroid hormone you produce, 80 to 85%, and the balance is T3. What the 3 and the 4 number refer to is a number of iodine molecules on the basic thyroid molecule. If you have 4 iodines, you have T4. If you have 3, you have T3. You wouldn't think that is a lot different, but it really is. T3 is a much more powerful hormone than T4. And your ability to convert T4 to T3 is critical for optimal thyroid health. Most doctors don't understand that. It's done by a process called methylation. If you listen to our methylation podcast, it's online wherever you hear us. It can help you really understand methylation, which is critical for your thyroid. So when you have a low thyroid, you can think of your thermostat being turned down at your house. Really, your thyroid is your great regulator. It controls your metabolism. It's your thermostat. If your thermostat's always set at 62 degrees, your house will never get above 62. You'll be cold. So what is one of the most common symptoms of low thyroid? You're cold. Your hands are cold. Your feet are cold. You need an extra blanket. You don't like to go out with short sleeve shirts. You want heavier clothes on. That is a very common symptom, one of the most common symptoms. People also have fatigue because your metabolism is slowed down. That's what thyroid hormone does. It controls your metabolism. It's your regulator. So you can think of every body system. What happens if it's slowed down? Well, your brain's going to have more fatigue. You're going to have more brain fog. You may have trouble sleeping, processing information. You may have hair loss. That oftentimes occurs in both hypo and hyper, too low or too high thyroid. But hair loss is common. Losing the outer third of your eyebrows, very common with low thyroid. If they're thin or you've lost your eyebrows, especially the outer third, can be a subtle sign of low thyroidism, hypothyroidism. You can look at your tongue. If you have indentations where your teeth push into your tongue, those little scalloped indentations, indicative of hypothyroidism. You may have skin tags. You may have some discoloration on the back of your neck, some darkening of the skin can be associated with low thyroidism, hypothyroidism. You also may have constipation. Very, very common. One of the most common symptoms of low thyroid is there's constipation, chronic constipation. You may have high cholesterol. That, again, is another common symptom or finding in routine blood testing. If your doctor says you have high cholesterol, you should be mandating a complete thyroid panel. We'll talk about that. You may have carpal tunnel syndrome symptoms. That is the numbness in the hands that occurs at your wrists where the median nerve goes through the carpal bones. Carpal tunnel syndrome, often associated with hypothyroidism. So those are just some of the common things that we see in people that have had thyroid concerns. And they go to the doctor, and the doctor does one test, a TSH, and it's told, oh, your TSH is normal. You don't have hypothyroidism. We'll talk more about that in a minute. The reality is, if you have some of those symptoms, fatigue, brain fog, weight gain, a very common symptom of hypothyroidism, inability to lose weight, constipation, dry skin, hands cold or just a feeling of being cold, hormone imbalance symptoms, hot flashes, night sweats, you indeed may have hypothyroidism. And one of the things we do at Wycoff Wellness in East Lansing is we look at the patient, and we always treat patients. We never treat the lab tests. So if it clinically looks and sounds like hypothyroidism, we're going to be looked to treat you for that problem. We'll talk about treatment at the end of this podcast. So keep listening. It's going to be informative, educational, and maybe it is your thyroid. So let's get you on that pathway to wellness and get you feeling better. So now you have some of the symptoms that you frequently see. If you look up hypothyroidism on Google, you're going to see things like myxedema and coma and such. And I tell you, those are such uncommon problems. We just don't see them in this country because years ago, decades ago, we started supplementing many foods with iodine. Iodine is critical for normal thyroid function, so we don't see severe hypothyroidism very often, but we see either early hypothyroidism or something called subclinical hypothyroidism, where people have the symptoms, but their tests really aren't that abnormal. So if you think you may have hypothyroidism, it may be your thyroid. And that's what we're going to learn about today. So do some more exploring. If your doctor has said, listen, you're kind of borderline, or I think that you may have low thyroid, ask to get the right test. So let's segue into what tests are the right tests, Dr. Wycoff. Well, if you're evaluating your thyroid completely, you will get a TSH test, thyroid stimulating hormone. The reality is, though, this is not a test at all of your thyroid function. It's a test of your pituitary gland. That's the gland between your eyes. That's the master regulator of many hormones. TSH is a messenger hormone. It sends a message to your thyroid gland from your brain to your neck to produce more or less thyroid hormone. So it's important that you understand what a TSH test means. If a TSH test is low, that tends to mean your thyroid function is overactive. You may have hyperthyroidism. Now, the symptoms of hyperthyroidism are just the opposite spectrum of hypo. You're going to be anxious. You're going to have excessive energy, unexplained weight loss. You're going to have diarrhea. Your skin will not be dry. You still may be losing hair, but the symptoms are completely the opposite of hypothyroidism. Hypothyroidism far much more common than hyperthyroidism. So don't get those two confused. So a high TSH, an elevated TSH, is indicative of hypothyroidism. Let's talk more about that level of TSH. It's a broad range of normal on your lab results. So you're going to see the test TSH. Next to it, you'll see your value and then the normal range. And the normal range will probably go from like 0.3 to 4.5 or 0.5 to 5.0. It'll be a range that's fairly broad, maybe as much as 20-fold from low to high. So you can imagine that, that's a big range from 0.35 to 5.5. Our kidneys regulate our sodium level within about 10 points, between 135 and 145, about a 10% swing. But we're talking about a 20-fold swing from low to high TSH levels. And remember, the higher the TSH level is, the more underactive your thyroid hormone is. Or thyroid hormone production is. So high TSH in the higher range or above that upper limits of normal is indicative of hypothyroidism. Now let's talk about that range a little bit. That's a statistical test norm based on the machine that ran the test. It includes 95% of the population who has the test. It's 2 standard deviations from the mean, and that's the low and the high level of that test, and really most tests that you see at any laboratory. It really is not the level of disease. For example, the American College of Endocrinology, they are really the gurus of hypothyroid or endocrine problems, including thyroid disorder, would say that the upper limits of normal should be no more than 3.0. Well, you can imagine that if they lowered that level to 3.0, all of a sudden millions of people in the country have now developed a disease, hypothyroidism, where before their doctor said, your TSH is 3.5, 4.2, you're normal. Let's just follow it. Well, in my world of functional medicine, we really believe that TSH should be no higher than 2.0. And personally, I'm usually shooting for 1.0 for optimal health. So remember that when you have a range in a test from low to high, within that range of normal is a subset range that we can call optimal. And if you're me, you want to be optimal. You want to be hitting on all cylinders, not hitting on 6 out of 8 cylinders. So find the optimal level of your TSH. It may be 1.2, 1.5, 2.2. But really, to get a full assessment of your thyroid, you need to have the other thyroid hormones done, your T3 and T4, and it comes in 2 forms, a free and a total. You want both, free T3, total T3, free T4, total T4. What does that mean? Free T3 is the amount of, and free T4 is the amount of free hormone available to be used. The total is the amount of bound and unbound, whether it's bound to a protein and it includes your free form. It doesn't always tell us how well you're making T3 available to your cells. So ask for both a free and total T4 and T3. The sine qua non of hypothyroidism, if you find an elevated TSH and a low T4 and a low T3, free and total, you undoubtedly have hypothyroidism at that point. But you can have normal T3 and T4. They can be in that normal range, maybe towards the lower level, lower end, and have an elevated or borderline high TSH and really be clinically hypothyroid and need treatment. That's what we do at Wycoff Wellness. We evaluate the patient. We treat you as a patient. We don't just treat the lab result. But get the right test. Get a TSH free and total T3, T4, and then you would like to get 2 thyroid antibodies. Thyroid antibodies do not have to be done every time you have a thyroid test, but they should be done at least once. And then they include the antithyroglobulin antibody and the antimicrosomal antibody, MICROSOMAL and thyroglobulin, THYROGLOBULIN. Those are common blood tests. All these are common blood tests. They're very inexpensive. Your insurance will cover them. And really, for a complete thyroid panel or a complete thyroid evaluation, in my opinion, TSH, free T3, total T3, free T4, total T4, antimicrosomal antibody, antithyroglobulin antibody. At one point in time, we were doing reverse T3s. Those have kind of fallen from favor. You might see that available. Usually has to be done at a regional lab like Mayo. So I don't get as much reverse T3 as I did years ago. But if you can get those other thyroid tests and can learn to evaluate them and get those levels into the optimal level, the optimal range, not just the normal range, the optimal range, really important. Get the right tests. Learn to interpret them correctly. Push your doctor to help you understand them. Do some research about optimal levels. And I think maybe it is your thyroid, and you can get on the appropriate thyroid support or medications to help you achieve optimal health. Okay, so let's talk about treatment. Well, I mentioned methylation earlier. Methylation is the process of taking an inactive hormone to an active hormone. In this case, inactive hormone is T4. We need to cut off one of the thyroid hormones, one of the iodine molecules, and make it T3. You would think that'd be easy, but that process of methylation is oftentimes governed by genetics, and you oftentimes need to have adequate amount of methylfolate, folic acid. You have to have enough methyl B12, enough zinc, enough D3, enough magnesium to do that. You also need the female hormone progesterone, and that conversion is blocked by excessive estrogen. So, for example, let's say your profile shows a low T3, normal T4, normal TSH. Right away, you can assume you have a methylation process problem, and you also are not converting efficiently the inactive T4 to the active form T3. You know where to look. Make sure you're getting enough of the right nutrients we talked about. Iodine is another important one. Getting on iodine, zinc, magnesium, vitamin D, maybe looking at hormone balance. Maybe you do need progesterone if you're a female, or maybe you have too much estrogen if you're a male. We can help lower the level of estrogen in men and help that conversion happen at a much more efficient way. Many, many women are estrogen dominant, which impairs thyroid hormone conversion. Let's deal with that and get you methylating your thyroid hormone better, making more active T3, and getting you on that road to health and wellness naturally. Eating healthy, dark green leafy vegetables, fresh fruit, fresh vegetables, lean meat, organic meat, free-range eggs, getting off of foods that have folic acid. Those are all your grains, any grain, not only wheat, but rye, barley, rice, just getting off of grain and eating more fresh fruit, fresh vegetables, lean meat, wild-caught fish can really help you achieve better health and wellness. It'll help you methylate and turn inactive thyroid into active thyroid hormone. Take those supplements. They can really help you. But let's say your thyroid level is fairly low and I feel or your doctor feels you need thyroid hormone replacement. Let's talk a little bit about that. So your doctor is probably going to prescribe a synthetic form of thyroid replacement, something called Synthroid or levothyroxine. That is 100% T4. There's a patent on Synthroid, and that's why he's prescribing it. It's because the pharmaceutical company has convinced him that it's the only form of thyroid replacement that you should take. Well, right away you should begin to question him. Well, why do I take 100% T4 when my body makes only 85% T4 and the rest in T3? Is there a product that contains both? And the answer is yes. The bioidentical forms of prescription thyroid replacement, either Armour Thyroid, ARMOUR, or something called NP thyroid. N as in no, P as in practice, NP Thyroid. These are available at any pharmacy. These are bioidentical forms of thyroid hormone replacement. They are porcine-based, meaning they're pig hormone-based. And I can't tell you a good reason that the pig thyroid hormone is almost identical to the human thyroid. Maybe we evolved in such a way, I don't know. But the molecular thyroid hormone in porcine thyroid products is very similar to that used by human beings. So it only makes sense at some level to say, well, listen, I want to be on the type of hormone that my body normally makes. Armour thyroid, NP Thyroid. Your doctor can write for those. He may not believe they're going to help, but about 9 out of 10 people that I see do better on bioidentical forms of thyroid hormone replacement than they do on synthetic forms. They also make T3. The product name is called Cytomel. Cytomel can help if you have low T3 levels and think that you're a poor converter. Sometimes I have people taking Synthroid and Cytomel. The reason that typically we don't use Cytomel alone or T3 alone is that it has a very short half-life. It gets into your system and it's gone in about 4 hours. The T4 containing products, whether NP or Armour or even Synthroid with T4 in as its only ingredient, they're going to last for about 18-hour half-life. So you don't have to be so concerned about taking multiple doses of thyroid hormone, which really you would do if you were on a T3 only product. Not that you couldn't do it. If you're willing to take a tablet 3 or 4 times a day, T3 will probably get you there. It just, it's hard for most people to be on that type of a pattern. So you can also get compounded forms of T3 and T4 in whatever ratio you would like. We do a lot of work at Wycoff Wellness in East Lansing with compounding hormone prescriptions, compounding many prescriptions. Compounding is the old way of putting a prescription together, the ball and mortar that you saw. And that used to be how all prescriptions were made. Doctor would write for a certain milligram of a certain chemical, a drug, let's say, and the pharmacist would compound it and put it into a capsule. And that's really what compounding is now. You can individualize your treatment with compounded prescriptions quite easily, and that's something that you should look into, especially if you have allergies. Some people are allergic to pork. We can get compounded bioidentical forms of thyroid hormone. Some people do better with more T3. And maybe the 80-20 ratio or the 90-10 ratios you find in Armour and NP Thyroid isn't quite right for you. Maybe a 70-30 mix, 70% T4, 30% T3 really does help you get to optimal health. Your energy's better, your brain fog's better, your bowel movements are better, your skin's not dry, you're not cold anymore. So, and for men and women, the other thing I really encourage you to do if you're having symptoms of hypothyroidism, get your sex hormones checked. Testosterone, progesterone, get the estrogens, estradiol, estriol, estrone levels checked. Because optimizing those can have a lot to do with how your thyroid ultimately works. And then get on the right diet, get off of the grains, get off dairy, get off sugar, eat fresh fruits, fresh vegetables, dark green leafy vegetables, and then supplement. Maybe some iodine, magnesium, vitamin D3, zinc, multivitamin with methylfolate like our Phyto Multi. We're going to talk in an upcoming segment about metagenic supplements and why I feel they're superior to other companies. And that's who we partner with, and they're available at our store in East Lansing, 1226 Michigan Avenue. That's our office. We also have a store there, and you can also order online 24/7, wycoffwellness.com. Ship right to your house just within a couple of days. So take advantage of those resources, and stop by if you're not sure what to take. My staff can help you. We have just some thyroid support supplements, something called Thyrosol. We have iodine. We have magnesium and zinc, all of which can help your thyroid function in a more optimal fashion. So on that pathway to wellness, getting your thyroid optimization done is important. Getting your test in the optimal range, not the normal range, getting the right test, getting those optimized, getting on the right supplements, and then if you need thyroid hormone replacement, we find about 90% of the time that bioidentical forms of thyroid replacement are the way to go. So take charge of your health, get on that pathway to wellness. If we can help you at Wycoff Wellness in East Lansing, come by. We're at 1226 Michigan Avenue in East Lansing, right on the western edge of the Michigan State campus on the 4-lane boulevard, just west of the Harrison Roadhouse, just east of Frandor or 127. We're just about a half mile off 127, about a mile and a half east of Sparrow Hospital. So let us help you get on that pathway. This is Dr. John Wycoff. Until our next podcast, take the steps to get healthy now.
The information provided in this podcast is meant to be informative and educational only. It is not intended to be specific medical advice. Dr. Wycoff suggests you discuss any of this information with your personal medical practitioner before beginning or changing any form of treatment.